stigma. Also, being African, do you think we are open to talking about it? Like, is that one of the stigma that we don't want people labeling our kids as being like crazy, like you said, or people are going to talk about us? Is that one of the stigma that's affecting the African diaspora people for not wanting to open up and talk about this? What do you think?
Oh, it's all not being labeled. It's all not just, and also, not getting a diagnosis, right? There's that, just fine about, oh, I don't want to diagnose that. But most importantly, how would my community members sees me if I find out that, if even if I find out that I'm getting therapy? Oh yes, I've seen that. I've seen in practice where the moment an African person sees you in the what do you call it, in the, let's just say, job organization, they automatically want to come back. It's happened to me, right? They didn't want to come back. So there's that stigma about how is this person going to look at me in the community, that stigma about the labeling, or am I going to be labeled like I'm a bad parenting? Bad parenting is what caused me to be at this table, right? So many things that people look at it, and people even look it to the point like you're crazy. And honestly, that kind of thinking, to me, I'm like, you must be this. And people even in diaspora, I mean, come on, we have a lot of verse people that are educated. Let's read the books, man. But want to just think, oh, it's like people still regard, my dear sister, I'm telling you, mental health as being crazy. Can you imagine that?
Yeah,
Right. So it's a lot, like it depends on how people want to look at it. But I think the bigger umbrella is the fact that I don't want nobody to know about it. I don't want to get the labeling. How will I fit in? It's like I become that bad apple in terms of parenting. Even parenting they don't want to come out to get help. Like I told you, I've had parenting sign for sessions, and the moment they see my name or they see, or even one at 10, and they don't come back anymore. Right? There's also that mistrust, and our practice, just like any other, um you have that strict confidentiality that I need to follow by my college. So I let parents know that, listen, you might know me, or I might be a part of the African community, but that does not mean that I will be spreading your news. That is totally, I cannot do that. So every job have their policies, every college that you belong to. So when people can have that confidence, because I honestly think that we are the people that can help our people, right?
true.
Because there's connection, there's also that cultural relevance, connectivity. I've seen clients also that literally said, I want TT because
That's
not only am I a Christian, I'm also a Black, therapist, I'm a woman. So there's a lot of things the same things that will draw people to you in terms of value of what they're going to get. The opposite is what's also going to make people say, I don't want to come back because of the stigma, the label.
I see. Thank you so much. So, what challenges do you think will stop people? So, for people that, okay, we see you, Dr. TT, you're one of us, we feel comfortable coming to you, but what are still some other challenges that will keep people from coming to seek that therapy, to come out? Is it more of, is this something that's, like this mental health, is it free? Are they able to get this counseling for free? Or is it something where, oh, they think like, oh, I have to go through my insurance to be able to get the therapy, to be able to see people like you. So is this one of the challenges that you see in our African diaspora? If they're willing to actually come out and say, you know what, I'm willing to talk to someone. Like, what challenges do you see?
I think there's multiple facets of challenges. So, we already talked about the stigma. That could be one of them. People also, like I said earlier, not able to find that culturally fits connectivity, whereby,
Okay.
for example, or even the religious worldview too. Also, like I've seen people, they will say, I want me a Christian. I'm
Okay.
that kind of person, right? So when you look about, socioeconomic status in terms of people not having access in terms of how are they going to afford therapy, right? There's also that cultural relevance, right? I know someone that knows my history, that knows my culture, right? Language
Mhm.
barrier is another one, right? Um, and even, so I said culture, socioeconomic status, language barrier, stigma. Can't really think of any other thing, right? And also being accessible also. But thank God these days, therapeutic intervention can be delivered like anywhere, right? With their access with virtual services. So that barrier has been cut off during pandemic. So now therapy is at your tip, right?
That's great.
But I think the most important thing that I see in African diaspora is number one, not even the money, because in Canada here where I live, our healthcare is universal. While it's universal, there could be a huge wait list, but most people tend to have private insurance. But I think it's just that stigma, I would think is the number one. And then number two, the cultural, being able to connect to someone that understands the experiences, like the lived experience of being an African. I've had people say, no, I saw the blacks, but I want, like I had one of my, someone that I know say, no, I chose you because I see that you're Nigerian. You know what I mean? And I
Yeah,
see that you're Christian, right? So I've seen that a lot. So that
yeah.
connectivity in terms of holistic values, the cultural values, although I don't speak other languages, but I speak Broken, I speak, Yoruba. So those are the things that when people don't see can also give a push, right? And getting services
That's
and getting help.
that's great. That's great to hear. So my next question is, how can faith